Welcome to B.Sc Nursing Decoded. Today, we're diving deep into one of the most incredible and sometimes frustrating parts of the human mind, our memory. You know, it's a tool you're going to rely on every single day, and it's something you'll need to understand in every single patient you meet.
So, let me ask you this. Ever have that moment where you can perfectly recall your childhood address, like down to the zip code, but you have absolutely no idea where you just put your keys? It's not just some random brain glitch, I promise. It's actually a perfect window into the amazing, complex machinery of how our brain grabs, stores, and pulls up information.
All right, so here's the game plan for today. First, we're going to break down what memory actually is. Then we'll look at the brain's 3 different filing cabinets for memories. We'll also figure out why they sometimes fail us. After that, we'll get into all the different factors that can shape your memory, and, most importantly, how you can seriously boost your own brain power.
Okay, let's kick things off with the big one. What even is memory? Because it's so much more than just remembering facts for an exam. It is the absolute foundation of who we are and how we function in the world.
At its core, memory is this incredible neurochemical process that lets our brain hold on to information and then pull it back up when we need it. I mean, think about it. Without memory, we couldn't learn a thing. We couldn't make decisions. We wouldn't even know who or where we are. It's the key cognitive ability that makes pretty much everything else possible.
So, how does a memory even get made? Well, you can think of it as a 4-stage process. It all starts with attention. You have to actually notice something first. Then your brain encodes it. That means translating it into a language it understands. Next up is storage, where it gets filed away. And finally, retrieval. That's when you go and pull that file back out. It's really just like a computer. You input something, it gets processed, saved, and then you open it later.
Now here's the thing. Not all memories are created equal. They aren't all stored in the same place or for the same amount of time. So let's crack open the brain's 3 main filing cabinets, because each one has a totally different job.
So the very first stop is sensory memory. Just imagine you're walking down a super busy street. For a split second, your brain is capturing everything, all the sights, the sounds, the smells. That's sensory memory. It's this ultra-brief holding pen, iconic memory for what you see, and echoic for what you hear, and it lasts just long enough for your brain to go, is any of this important?
If your brain decides something is important, like, say, a phone number someone's reading out to you, it gets bumped up to short-term memory. You can think of this as your brain's mental sticky note. The catch? It can only hold about 5 to 7 things at once, and only for about 20 to 30 seconds, unless you keep repeating it to yourself.
And then we have the main event, long-term memory. This is where information goes when you really work with it, through things like repetition and connecting it to what you already know. This is your brain's massive, practically infinite hard drive. It's where you keep all your knowledge, your skills, your life experiences, everything from the capital of France to the feeling of your first day at nursing school. And when you put them side by side, the differences are, well, they're huge. Short-term memory has this tiny capacity and a super short fuse. Poof, and it's gone. Long-term memory, on the other hand, has a basically unlimited capacity and can stick around for your entire life. Forgetting here is a much, much more complicated deal. And even within that giant long-term archive, there are different types of files. You've got declarative memory. That's all the stuff you can consciously talk about, like facts and events. It's about knowing what. But then you have procedural memory. This is your memory for skills and habits, knowing how. Think about riding a bike or starting an IV. You don't have to consciously think through the steps. Your body just knows.
Okay, so if our long-term memory is this massive, amazing archive, why on earth do we forget things? Well, it turns out that forgetting isn't always a system failure. In a lot of ways, it's actually a feature that helps the whole system run better.
So, by definition, forgetting is just when we can't pull that information back out of the system, whether it's for a minute or forever. But the really cool part is digging into why this happens. Let's look at a couple of the main theories.
So the first idea is super intuitive. It's called decay theory, and it's basically the use it or lose it principle. The idea is that when you learn something, you create a little neural path in your brain. And if you don't use that path, well, it just fades away over time. You know, like a trail in the woods that gets all overgrown if nobody walks on it.
It's kind of like an old photograph, right? When it's new, it's all sharp and vibrant. But if you just leave it out, over time, it starts to fade until you can barely make out the picture anymore. That's a perfect picture of decay theory in action.
But what if the memory isn't actually gone? What if it's just lost? That's the idea behind retrieval failure theory. The information is still in there deep in your long-term storage, but you've lost the right key to unlock the file. This explains that super frustrating tip-of-the-tongue feeling. You know it, but you just can't grab it.
All right, so we know how memory is supposed to work, and some of the reasons it fails. But what about the things that affect its performance every single day? Now, this is where it becomes absolutely critical for your nursing practice. Understanding these factors will change how you assess your patients and how you care for them.
Look, memory does not exist in a bubble. It is deeply, deeply tied to our physical and emotional health. Just look at the clinical conditions on this list. For a patient who's had a head injury, memory loss might be their biggest challenge. For someone with diabetes, those swings in blood sugar can create serious brain fog. Even something like stress, like the stress of just being in a hospital, can make it really hard for a patient to remember your instructions. So this isn't just a list for a test, it's a clinical checklist for every person you see.
But here's the good news. We are not just at the mercy of our memory's little quirks. We can actually take steps to make it better. So, let's talk about some real evidence-based techniques you can use, not just for your own studying, but to help your future patients too.
And one of the most powerful tools in our arsenal are mnemonics. They're basically memory hacks, right? They're little tricks that help you encode information by linking it to something you already know, which makes remembering long, complicated lists way, way easier.
Here's a whole toolkit for you. Simple things like organizing your notes or chunking a long number can make a huge difference. For more complex stuff, you can try the method of loci. But honestly, the absolute gold standard is deep processing. Don't just memorize a list of a drug's side effects. Instead, think about how those side effects would actually impact a real person. When you connect new information to real-world experiences, that's when it truly sticks.
Okay, let's pull all that together real quick. We've learned that memory is a 4-stage process, and information flows through 3 different storage systems. We know that forgetting is totally normal, usually because of decay or just failing to find the right cue. We've seen how much our lifestyle and our health impact our memory, and, most importantly, we know that we have real strategies to actively improve it.
So, I want to leave you with this final thought. Getting a handle on how memory works isn't just some boring academic exercise. It has real, profound implications for how you're going to study, how you'll teach patients about their own health, and how you'll assess what's going on with them. So the question is, how will you take this knowledge and apply it on your journey?